He's a very caring doctor. He really is. I mean, a doctor that will give you his personal phone number and tell me to call morning, noon, or night. Yeah. My name's Jean Monticello. I'm 67 years old. I'm retired. I used to be a medical receptionist for 5 doctors, which I enjoyed very much. I have 3 grandkids and 2 kids. I tore my meniscus playing pickleball. When you have a torn meniscus, it's like a hangnail almost sticking up. I thought if they went in and they clipped that off, that it would be okay. Well, it wasn't okay. And so then I had the shots. That lasted for a while. And then by then, I was gone down to bone on bone. So by then, it was surgery time. As far as X10 goes, I think that everyone should have one because it's very beneficial. It brings your leg, you have the extension and the flexion. And I think it helps your leg to get where it needs to be. Because I've never had a machine do that for me. And I think it will help benefit a lot of people. I had a CPM, which I didn't care for. I didn't think it did what it should be doing. And then I had the therapy, which to me was very painful.
What therapy was that?
Physical therapy.
In-home or outpatient?
Outpatient. And to me, that's, I mean, part of it was okay, but when they're pushing on your knee to straighten it, it's painful. Where with the X10, you don't have someone pushing on your knee, but you have the extension that's helping you straighten your knee. I mean, there's good hurt and bad hurt. This is a good hurt because you know that you're going to benefit from it. You control it. They don't control you, which is nice. But you still have to push yourself to increase it to get the results that you want to get. I would recommend it. And I cannot believe that they don't have this machine available to every patient that has knee replacement, because I think this is more beneficial than physical therapy or anything else, or a CPM. He explains to people what's going on or what's going to happen. And he takes time with his patients, which I think means a lot. Rather than wasting his time and the patient's time with all this other stuff, I would recommend going to the X10 right out of surgery, because I think it's going to help the patient get better quicker. I really do. And I mean, I'm on it 3 times a day, and I can tell the difference.
X10, back to full strength.